Okay. Hi, everyone. My name is Aisha Miller, and today I'm going to be informing you about why it's important to have annual exams. I know when you think of annual exams, it's like, oh my gosh, I gotta go to the doctor, something's wrong, or maybe even bad news. But that's not always the case. So, why is it important for us as individuals to have annual exams? Is to discuss. I'm sorry, things that that can be concerning, alarms, maybe not feeling well, or even maybe some symptoms that your body maybe been able experience that you're unable to get better at home, and you need to see medical professional assistance. And it is important as well for when you do is to make sure that you feel safe talking with your doctors and that you know that it's a safe place for you to talk about your health and concerns. And I'm also going to be discussing with you about what it goes on during an annual visit. So maybe that you're not so um, maybe on the not so of I don't want to go to the doctor sense. Okay, so when going to the doctor, the first thing they're going to collect is, you will meet a medical assistant, and that works alongside with the doctors, and they'll be the ones who normally will take your vitals, oxygen level, blood pressure, and things like that. So your oxygen level is basically, measured with a little device that goes on your finger, and it measures the oxygen level in your body. Now, with your blood pressure, we normally apply a blood pressure cuff to your arm to where, it makes sure that your blood pressure is in normal range, and which is a normal range of blood pressure is 120 over 80. Anything higher, 150s and up, it's something to definitely consult with your doctors about because some people do have hypertension, blood pressure. So that's another thing. And as well as the biggest one is temperature. So definitely our normal temperature is 98.6. Anything of like a 102 and up, that's definitely where you should go and see urgent care assistance to find out because your body can be fighting an infection, you can be getting sick, or something that's basically your body is giving you a symptom that something's wrong and you're not feeling well. Okay, another thing that's important when having an annual exam is discussing medical history and family history. Why is that important? Because doctors are able to, assess, maybe underlying genetics or pre existing conditions, to look for when caring for you and over your health as you come in each year for your annual visits or things you may be experiencing that your doctors can help you understand. So it's very, very important that you don't leave out any viable information like that because it can also lead to your doctor missing something or even misdiagnosing you for a disease that later comes along that maybe could have been prevented in the long run. So that's definitely, important to feel comfortable with your doctors and sharing and talking about family medical histories, any surgeries you've had done, any lab work, any minor injuries or anything like that that you've also had in your past. That's very, very important. With having a physical exam for women and men, it's a little bit different, but it's still the gist of having a physical annual exam done. With women, we normally have pap smears, breast exams, looking for breast lymph nodes. And that is important because now we're seeing cancer, breast cancer, at an early age. And they're doing early screenings, for us as women to be able to fight and beat cancer with catching it more early than later on when it's more aggressive and unable to be in remission stage and beat that cancer. Another thing as well is with men. And men have, they have hernia exams, they have prostates, and also testicular exams, to make sure they looking into their STIs and things like that, as well as women looking into their STIs. And, we also do STD screenings as well. So that is definitely important while going and having an annual exam is done. As your doctors are definitely looking into that. They may also check your eyesight, your ears, and things like that. So it's very important that you definitely follow up every year and having that annual exam done. Now, when before ending or you leaving out of that doctor's office, they normally write, summary notes of things that you've discussed inside of your doctor's appointment. And this is a time where you can speak up, ask as many questions, as you need to make you feel comfortable. And please know that any question is not a dumb question at all. So please always make sure that you feel comfortable with definitely just like, hey doctor, if this happens, does this seem right? Or hey, I've been having this feelings or these headaches or these stomach aches and things like that. So that's definitely important to address any viable concerns that's going on within your body. So that is important. Also, labs is a very critical when having your annual exam done, where doctors, they'll draw blood or they'll send you to a lab, which is like diagnostic quest, or where you'll have labs drawn, and they normally take about 72 hours to get back. Sometimes they come back a little quicker as well. And, if your doctor sees anything alarming or concerning or something's come back that they need to discuss with you, they will then request a follow-up appointment, or, hey, we're going to put you on this medications, or even if you take daily medications, they can readjust your medications as well. So that is very important, making sure you're getting those lab works done and things like that. That is very vital, important information when having an exam done. So the overall gist of what the annual is to make sure that your body is functioning as it should and that you're healthy and you feel safe and your doctors are able to care for you the way you would want to be cared and able to help you live a good, long, sustainable life. So I thank y'all so much for listening into, and I hope y'all found this information of why it's so important to have annual exams done. And I look forward to talking to you next time. Bye.